How's it guys? Welcome back to my channel. Today we will be doing how to do first aid for drowning. So first of all, pretty clear what drowning is. If someone falls into the water and they breathe in the water, what are you going to do for this person? So first of all, you're obviously going to need to pull them out of the water. You can turn them onto their side if there's any water in their mouth, but there's no need to try to like hang them upside down. Water will not come out of their lungs. If they are coughing, or they're trying to breathe, that is excellent. You need to be calling for help straight away. So whatever number you're going to call for an ambulance or get some sort of help moving towards you as quick as you can is ideal. What is important to say in that point as well is that even if someone has a near drowning or someone who falls into the water and breathes in some water and they feel fine, but they're pretty sure that they breathed in some water, they should also go checked out and they should go to hospital because they can have a secondary problem later on. So that water can cause infections, that water can cause all sorts of problems, and that would be really bad. So you want to get going to hospital, even if it was like what we would call as like a near drowning. You want to go to hospital even if you are okay. So if you do pull out someone from the water and they're not breathing and they're not moving, you're wanting to tilt them to the side. You can get whatever, if there is any water in their mouth, out of their water, out of their mouth, and that may have some help. And then you're going to want to do CPR. So I have made a video on CPR up here. I'll drop a little tab to that. But really what you're going to do is you're going to do 30 compressions on the chest, so the bottom half of the sternum, the chest bone. You're going to push hard and you're going to push fast at a rate of like 100 to 120 beats a minute. Pretty quick. There's a couple of songs that fit to that beat. You know, I can't sing, but. And then you're going to give ventilation. So in this point, ventilations are very important. Ventilations are quite hard to do, especially if you've never done them. They're probably vomiting. It's going to be very unpleasant. So unless you have experience in this or you feel like you're going to be able to, or if it's a loved one and you're like, you know what, I'm going to do it anyway. You're going to grab them by the head. You're going to tilt their head backwards. You're going to block their nose with your one hand. And you're going to cover all of their mouth with all of your mouth. So your lips need to seal onto their lip. And then you're going to give a breath. You give 2 breaths and you get back to compressions. You do 30 compressions. Once you've done 30 compressions, you go back to your breaths. So breaths are very important. Normally in CPR, if they've just had like a heart attack or something, breaths are less important. But because of the reason of the person now having no heartbeat, because if you pull them out and they're not breathing, it means their heart is not pumping, which means you need to do CPR. 30 compressions, 2 breaths, and you do that until help arrives. Drownings are very, very tough to deal with, especially if they're like younger kids. The 30 to 2 applies for children as well. You just do the same thing for children, same thing for adults. Pull them out, turn them on their sides, put them back on their back, CPR, 30 compressions, 2 breaths, and that is how you would deal with drowning for first aid. Guys, if you like this, please hit like and subscribe. If you have any comments or queries, drop them below. I'll get back to them, and I appreciate your time. Bye for now.